Hi, welcome to the Gravity Doctors. I'm Dr. Brennan Spiegel. I'm a professor of medicine and public health. I'm also a gastroenterologist and the author of the book Pull: How Gravity Shapes Our Body, Steadies the Mind, and Guides Our Health.
And I'm Dr. Lachlan Kent. I'm a psychology PhD and I research mental gravity, so the connection between physics, the mind, and in particular, mental health.
Between the two of us, we're the Gravity Doctors. We're interested in both the mental and the physical and the mind-body connections between health and the pull of the earth itself. And so today what we thought we'd do is talk about our top 10 anti-gravity techniques. These are take-home techniques that you can think about and apply right away in your lives.
So through the podcast, there's going to be a lot of theory, there's some philosophy, we're going to talk about evolution, we're going to talk about all these broad concepts, but really the rubber hits the road with the practical tips. How can you use these principles to shape your mental health, your physical health, your overall well-being? So we've got 10 lined up today. Shall we start with number one? We ready?
Yeah, let's go through them.
So the first one is hack your Gravitostat. So we're talking about weighted vests, standing desks, and ankle weights.
Yeah, so let me explain that. What is the Gravitostat? Well, it turns out that we have this system in our body that is constantly measuring our weight. And if we slowly accumulate weight over, weeks and months, it doesn't really trigger the Gravitostat.
Body weight.
Yeah, body weight. But if all of a sudden you weigh yourself down, let's say you put on a weighted vest, or there's an exercise called rucking, where you can run around with a weighted backpack that's become pretty popular. The body senses this extra load, and it can increase the metabolism within the body, and it can lead to weight loss, turns out.
Does it change like bone structure and things like that as well? Is it actually saying, okay, I need to be able to brace against extra load? So it's changing your physiology, is that right?
Both. Over time, when you use your body, it gets stronger, including the bones. So we know from astronaut research, for example, where they have the opposite of this. They don't have a Gravitostat being activated. They have microgravity, almost no gravity, really. And their bones start to thin out if they don't exercise a lot. Whereas if we use our body a lot and put weight upon it, the bones become stronger and stronger. So there's a physical component, but there's also a neurohormonal component. It's almost as if the bones become an endocrine organ where they secrete almost like neurohormones that go back up into the brain and then trigger this metabolic response to lose weight over time.
Bones secreting hormones. Doesn't sound right, but we'll believe
It's a strange idea. Yeah, it is.
So we're talking about weighted vests, standing desks, and ankle weights. How do they sort of exercise this Gravitostat?
Right. So when I'm at work, I take advantage of all of these things so that I'm not passive. I have a standing desk, and I know you do too.
Me too, yep.
So
since 2008, I was an early adopter.
That's pretty impressive. I've been using it for several years. It helps me concentrate and focus, and we'll have to do a deep dive on this, I think. But what it allows is not only the upright posture, but to wear the weighted vest, and I have ankle weights on both my ankles. Each one is 20 pounds, so I carry around 60 pounds at a time at work. Not that everyone should do that right away, but you can work yourself up to it. And for me, it's been a very powerful way to use the force of gravity to strengthen my body when I'm doing what might otherwise seem like a really passive activity, which is just sitting around working.
It could be sedentary, but you're making it almost a passive form of exercise just through load bearing. I just note that for weighted vests, I've got a bad lower back. Be careful when you're wearing it. Don't twist and turn. Be very careful. There are risks associated. But that's our number one tips is hacking your Gravitostat. Number two is anti-gravity mental imagery and VR.
Yeah, so we use a lot of virtual reality in my laboratory. I have a research lab at Cedars-Sinai, and we spend a lot of time creating visualizations that are more than gaming and entertainment. This is really to help support mental and physical well-being. And it turns out one of the most popular visualizations that we've developed is this ability to float up. Even when you're not literally floating, you imagine as if you're floating up into the clouds, into the sky, into the heavens. And patients really enjoy this, particularly in the hospital when they might feel penned in and lying in bed. We're not designed to lie flat all day. And we take some of our most vulnerable people who are ill and infirmed, and then we lie them down.
Yeah.
Lay them down? Anyway,
Yeah.
they're flat, and we're not really meant to be. So not only is that not good physically, but it's not good mentally.
Yeah.
And virtual reality can help with this. But there are other ways, surely, to visualize anti-gravity experiences.
Yeah, you don't need a VR headset. Not everyone's going to have one of those at hand, and you might be out and about. But I think it's for when you're feeling sort of low energy or you're feeling down. You might be depressed, but you might have just been bedrotting all day, and you might feel that you need to alleviate, some mental burden. You might feel like your posture's not right. Your body's just not set right. You might want to alleviate some of that mental burden. So for sort of temporary relief, I do it sometimes myself. I've been working with this idea. I think there's maybe even an app that people could draw on to have some sort of guided meditation. Mm-hmm. But really the idea would just be to, in your mind's eye, imagine that your body is floating, that it's ascending, that all the tension is sort of relieving from your body. It's sort of leaving or ascending. I don't think you need a physical stimulus for that. I think just mental imagery itself is really important, because there's a part of the brain that works on mental imagery. We've talked about it in other episodes, the anterior insula. That part is doing a mental gravity simulation, and it is the conductor of the body that's the orchestra that says, what is the state of my whole body and my mind? And just doing that sort of mental flotation can be a good way of just changing that simulation temporarily.
So maybe in the show notes, we'll put an anti-gravity meditation
for sure
that people can do. And I think the bigger picture here is that gravity management is not just physical, but it's also very much mental. And we'll be talking a lot more about these topics as we get farther into our series.
The brain is sitting atop the gravity hierarchy for sure. So that's number 2. Number 3 is flotation, mindfulness, and anti-gravity yoga. So I can talk a little bit about flotation. I've done it a few times. This is where you go into a pod or a room with water that's been hypersalinated. So it's like the Dead Sea. You float, more easily than you would in regular water. You don't need buoyancy. The buoyancy is in the water itself. And it sort of takes all the weight and distributes it evenly across your body. The water is also at skin temperature, so you kind of lose that body boundary between your skin and the world, and you just feel like you're floating kind of in nothingness. It's the closest you can possibly get to weightlessness on Earth. And the effect is almost like an altered state of consciousness. The research on this is it induces not just relaxation, but kind of an alteration of your perceptual boundaries. And that, again, targets the insula, this part of the brain that does that gravity simulation. And it sort of sends it on a bit of an open, it's not a trip, but it is an altered state of consciousness that is good for anxiety, good for depression, and not just in the, I'm just feeling relaxed. It's more than that. It's a deeper kind of relaxation.
Yeah, I've experienced this firsthand in the Dead Sea. Went to Israel, and it really was an otherworldly experience to feel the buoyancy, to actually feel the lack of gravity on my body. And I remember closing my eyes and bobbing up and down, and then opening my eyes and seeing this vast desert blue sky, and everything was just so incredibly peaceful and transformative. And there was this sense of timelessness about it, which is part of this notion of flow state, where you feel as if time doesn't have the same meaning. It slows down or stops. And, just being so like consciousness being distributed beyond the body itself, because you're floating in this water that is an expanded, like literal physical substrate for your consciousness to distribute across. And, the experience is really quite amazing.
Yeah. And they talk about it in psychedelic therapy, where they have, mushrooms or LSD. They call it oceanic boundlessness.
Right. By the way, you feel literally high. Literally. Right? We're talking about gravity here. High versus low. These metaphors are not just metaphors. They're literal in a neurophysiological sense, right?
But it's the oceanic boundlessness that people experience in sort of deep psychedelic states. That is therapeutic. They found that that's the therapeutic part of those kind of interventions as well. In addition to flotation, you've got mindfulness and anti-gravity yoga. So mindfulness in itself is essentially how we feel grounded and sort of focus the mind on the present moment. Again, that's to do with time. You mentioned time perception. Again, the anterior insula is involved in that, in sort of smoothing out the flow of time. Anti-gravity yoga. I've done yoga for about 10 years myself, from lower back issues. And without being hyperbolic, that has changed my life. That's changed not just my posture, it's changed my core strength, my flexibility, my all-body sort of integration. Where I'd done a lot of sport before about coordination and power and endurance, when I sort of reached about 30, I realized I need to do some body repair. And really, it was repairing my relationship to gravity. And yoga is really a great way to do that, especially the inversion postures. You talk about these in your book, being able to take sort of the blood flow the other way, have the back sort of inverted against gravity. There's a real kind of reset feeling after you've done those postures during yoga. Your body feels not just refreshed, but kind of engaged.
I mean, something like the child's pose, where you just bend over and put your head on the ground, your forehead to the ground, and you put your arms out in front of you, is so refreshing, in part because there's the body stretch, but in part because you're reperfusing your brain, something we'll talk about a bit more in a moment, with blood and oxygen. And so this is all about gravity management. And, you know, there's so many ways to think about your position in relation to the world as a therapeutic tool. So many of my patients, for example, who have stomach problems like irritable bowel syndrome, find that if they do inverted yoga, it actually relieves their abdominal complaints as well. Or they might use a tilt table where you flip yourself upside down a little bit, and it's refreshing for some people. For some, it might give you a head rush and a little bit of a headache, so be careful. But the idea is just thinking about these different ways of manipulating your body in relation to the axis of pull that the earth exerts upon us.
Yeah, so there's 3 different ways. They're all quite different: flotation, mindfulness, and yoga. One's active, one's passive, and one's, you know, you've got to go to a site to do flotation. But they're just different ways, but we've kind of bundled those together. So that's 3. Number 4, this is your core area of expertise. This is aligning your gut. So we're going to talk about the Squatty Potty and acid reflux.
Yeah, and these are all very different, by the way, and we'll unpack all of these in some of the episodes to come. But as I mentioned, I'm a gastroenterologist, and I see people who have acid reflux disease, or they might have stomach aches, bloating, constipation. And it turns out there are a few different ways to align your gut, your GI system, with gravity to feel better. A classic one is how you sleep at night. For people who have acid reflux disease, which is a condition where stomach acid creeps up into the chest and causes burning and discomfort, particularly at night when we're lying flat, at that point, that check valve at the end of the esophagus is really vulnerable, and acid can come right up. And it turns out there's a very effective approach, as effective, if not more effective than medications, which is to tilt the head of your bed a little bit. Either you put some blocks under the head of the bed, the feet maybe just a little bit, like, you know,
It's
a few inches.
5 or 10 degrees.
At most, right? Or you get a wedge pillow. You know, if you sleep with somebody else in the bed with you, shares the bed, they may not want the bed tilted, so you can get a wedge pillow. Not pillows just under your neck. That just cranks your neck. But you want the whole torso to be inclined just a little bit. And also, if you sleep on your left side, it turns out left side sleeping in clinical trials shows better outcomes because gravity pulls acid away from the check valve on the left side, whereas the right side is worse. So that's just one example of aligning the angles of your gut with gravity. Another is pooping, right? So we all poop, and some people get constipated. They have to really work hard to push their poops out. And it turns out the way we poop on a toilet is really not all that natural. It's not optimally aligned with the force of gravity. So it leads to a lot of straining. People can get hemorrhoids. What are hemorrhoids if not a form of gravity intolerance? Too much gravity in just the wrong place, right?
Yeah.
So, you know, what we do is we can use something called the Squatty Potty, which is, I find, very helpful. Our patients love it, where you have a little footstool. It helps change the angle. By bringing your knees up a little bit, it's more consistent with how our ancestors pooped before toilets, right?
Yeah.
Just by squatting in a field somewhere and letting loose. And it works a lot better, actually.
I have to give you the Australian language version of that. We
Yeah.
call it a bush bog. Yep.
Okay. I like it. I like it.
Okay, so that I've got nothing to say about those. They're very physical. There's nothing really mental about those two. So that's number 4.
Well, it makes you feel better if you can get your poop out.
It
So there
does
you go.
make you feel better. That's right. It's the flow-on effect.
It's a flow, right?
Okay, so number 5 is pump it up. We're going to talk about grip strength, dead hangs, and squats.
Yeah. So, your musculoskeletal system, or skeletal system, as you like to call it, is your primary anti-gravity organ. So if you're not strong physically, bones, muscles, tendons, it's hard to, stand up and stay up against the force of gravity. So naturally, we want to be strong. It turns out grip strength is a very predictive measurement for a variety of different clinical outcomes. The stronger your grip strength, the stronger your body, and the more gravity resilient you are physically, your gravity fortitude, as we like to call it. And as we get older, grip strength gets weaker. So you can measure your grip strength. You can go online and buy a grip. It's called a dynamometer. And there are various measurements, and you can read more online about what a normal grip strength is for men, for women, for young and old, and see how you compare. And the nice thing is that grip strength, of course, can be modified. It's not that you need to just work your wrist out or your forearm out. It's that is reflective of your general body strength. And so it's really worth thinking about. And it turns out dead hangs are a really interesting anti-gravity exercise. Rather than doing pull-ups, which can be quite difficult at first, you just
and
hang.
a lot of stress on shoulders. Like a lot of
Yes.
people, once you get to a certain age,
That's right.
the shoulder cuffs become a little bit vulnerable.
Absolutely. Nothing wrong with pull-ups, but just literally hanging from a bar, first of all, it's very difficult. If you can do it for even 20 to 30 seconds, you're already pretty strong.
Yeah.
Just hang from a bar, have your hands at about shoulder width, hang down, put your full body weight from a stable bar, see how long you can do it. It's good for shoulder stability. It's great for upper body strength. Even your abs and your core get a workout.
Because you got to lift your legs.
You got to lift your legs up off the ground. You might, move back and forth a little bit. And if you can do that for a minute or 2 minutes, you're strong. And you're literally using gravity to stretch your body out at the same time. It's great for spinal health. So we'll talk maybe more about these exercises in future episodes, but dead hangs are a very good exercise.
What about Batman doing inverted hangs? Do we recommend those? Maybe not.
That's the tilt table, I guess. Yeah, hanging like a bat.
Yeah. So that one was squats. So I do squats pretty much every day, and I find that's I'm not bearing any weight. It's just a way of, while I'm working, while I'm, been sitting and standing, just to keep, the fluid pumping through the body. So if my legs start to feel heavy, I'll just do, 20, 30, 40 open squats. It just gets thighs, hips, lower back, core, everything working. I think weightlifters or, personal trainers say it's the core exercise that brings everything together. That if there's one exercise to recommend, it's squats, just repetitive up and down movement, sort of whole body exercise.
And if you think about it from a gravity standpoint, right? Because, this isn't a show about working out, right? It's a show about gravity. But what's happening with squats is what you're doing is helping return the blood from your legs back up into the core. Gravity's always pulling our fluids down, and we have these inner pumps and tubes, like hydraulic systems, that are constantly pushing all of the fluid back up. We have about 5 liters of blood circulating in our body. We need to get it back up to our brain, that control center, so we can sit up and talk to each other and not pass out. And so it turns out a lot of that fluid pools down in the lower legs, and when you do squats or leg lifts, what you're doing is you are squeezing the veins, which have one-way valves that go back up to the heart, and you're really helping to circulate the blood. When you're on an airplane, for example, it's especially important so you don't get blood clots, which is another form of gravity intolerance. And we know this in the hospital, where we use compression stockings and ask people to really move and work their legs out while they're in the hospital.
And it gets the glutes going. I think that's what gets missed especially in sedentary work, and even just standing. You're not actually using your glutes. They're just frozen in position. And I think even, I flew over here from Melbourne to LA, and I was just squeezing my glutes the whole time. No one could see, obviously, but it's like a little pelvis glute exercise, and I felt that just kept everything moving.
Well, there's something
well.
called dead butt syndrome.
Yeah,
That's
yeah.
the very formal medical term. I think it's actually called gluteal amnesia, as if your butt has fallen asleep or whatever. And it occurs from sitting down too much and being sedentary, and you can't activate those butt muscles as much. And people get back pain, and it's not just about the strength in the butt; it's about stabilizing, your pelvis and your spine, because that's a very vulnerable gravity management point where the spine anchors down into the pelvis itself, and the glutes are really important to stabilize that.
Glute, like it's gluing the body together.
That's
it's
true.
holding everything together.
Yeah, right.
Okay, so that is number 5. Number 6 is toe running. This is your specialty.
Well, I talk a lot about this in my book, Pull, right up front in the first chapters, about my own experience with toe running. And just to take a step back, our feet are gravity management surfaces. That's how I think about them. All of our body weight is supported on this surface area at the foot, which is at most about 5% of the total body surface area, is holding up 100% of our weight, which makes us unique, right, among most animals because we're bipedal upright organisms.
Yeah.
And that's a lot of pressure on the feet. So we really need to think about them as gravity management surfaces.
Like the interface.
Exactly, right. It's where we interact literally with our home planet. Now, we're spending too much time on our butts and glutes, and we talked about that before. So, running, when done right, is really the art of distributing the forces in just the right way across the forefoot, not the heel.
Yep.
Many people will heel strike first, and the heel, which is called the calcaneus bone, is this hard rock of a bone that's really designed to keep us from not falling backwards on our butt when we're standing upright. But it is not meant to be the impact point of running. That sends transmits forces right up into the knee and up into the hip and causes a lot of knee and hip pain. Whereas if you strike the forefoot, it distributes the forces much more naturally across the lower leg. And so I happen to run in these Vibram 5-finger shoes, and they look funny. They're like basically barefoot running, but you've covered your foot.
They're like gloves, aren't they?
They're like gloves for your feet.
Yeah.
And I'm not recommending everyone do these. They can cause problems. If you're not careful, you can literally fracture your foot.
Yep.
I've run at least 10 marathons in them. I've not fractured my feet, but you have to go slow and get used to them. But for me, I actually shaved about 20 minutes off my marathon time in those shoes.
So I've tried a bit of toe running while I've been here in LA, and I've got very sore calves. So I can vouch for the fact that you've got to acclimatize to it. You've got to adjust to them gradually. But as a kid, I had heel spurs. So I used to wear orthotics because I used to land on my heel. I also had shin splints. I have, strong quads because the foot wasn't doing any work.
Kind of soccer body, soccer legs.
Yeah. And, lower back and hip issues because I was running. Now, in hindsight, after talking to you about it, realised that I was running with a poor technique. I'd never had my technique corrected.
Absolutely, yeah.
So interested to see how this toe running
check out the book
goes.
Born to Run, which is what I read to learn all about this. It's a spectacular book all about barefoot running.
Okay, that's number 6. Number 7 is Undrain the Brain. We're talking about sleep, strokes, and yawns.
Oh, yeah. This is a big topic, so we'll be tight about it here because we can have probably will have an entire discussion about this. But, when we're walking around all day, we're talking right now, we said this earlier, your brain, the control center is at the very top, the farthest away from the ground. And so part of what we evolved to do is to pump blood and oxygen up into that control center to keep the lights on. And over the course of the day, especially if we don't have enough fluid in our body, it can become harder and harder to keep that going, and the brain gets tired. And so there's a few ways to make sure we undrain the brain, make sure it stays well perfused, which is the technical term. And one is just to drink enough fluid. You really need to drink a lot of fluid, between up to like 10 to 14 or 13 glasses of water per day. I mean, I don't know about you, but I don't drink near enough water.
Yeah. And what about, so that's an everyday kind of intervention. What about when you or someone near you is having, or you suspect they might be having a stroke? What should people do?
Yeah, so a stroke is really a time when we need to reperfuse the brain. This is a serious situation, of course, where there's a blood clot in some cases that is led to a discontinuation of blood flow. And it turns out, we know from one amazing study from the University of Tennessee, that if you're having a stroke, that if you lie flat on your way to the hospital, there's considerable difference in neurological recovery on up to like 40% difference compared to if you're sitting upright in the ambulance. Amazing. Just a change in posture leads to a change in fate. Really powerful example.
Yeah. Okay, that's number 7. Number 8 is more specialized. This is vagus nerve stimulation.
Yeah. Well, the vagus nerve is one of the key connections between the brain and the body, particularly the heart and the gut, my favorite organ. And it turns out that the vagus nerve is involved in gravity management. And we'll have to unpack this in a future discussion because we can talk about this for an hour. But in short, the vagus nerve is helping you to moderate your blood pressure and your heart rate, to keep those pumps and tubes primed in just the right way as you move from sitting down to standing up, for example.
We call this sympathetic tone. Is this around sympathetic tone?
Yeah, this idea of sympathetic tone versus parasympathetic tone. So sympathetic is a sort of fight or flight idea. You got to be ready to fight or run. And the parasympathetic we call rest and digest. This is where you're kind of chilling out and relaxing.
So they're different modes, different sort of neural modes.
Yeah. And as we think about it, sort of tie it back to gravity management. And one of the other big parts of this is the vagus nerve. I think of it almost like a spigot that if you turn it on, will release serotonin in your body.
Yeah.
Serotonin in the brain and in the gut, where most of the serotonin in your body comes from, it turns out, is from your gut. And we'll have to talk about this too in a future episode, but serotonin is a gravity management substance. And we'll talk more about that because, again, we can go on about that for quite some time.
But how does vagus nerve stimulation work? What's the mechanics of it?
So the way it works is there's a few different ways. The way I do it is using a little electrode in the ear. And you can get these online. They're relatively inexpensive, and you just buzz your ear. And it turns out the vagus nerve has a branch, the auricular branch that goes up into the ear area, and you can buzz it and activate it. Or there's other ways right on the carotid artery. You can find the vagus nerve and buzz it there. Now, medically, there are medical grade versions where they're actually implanted under the skin for certain people. In fact, it's FDA cleared for epilepsy, for example. We use it for people with inflammatory bowel disease now, more experimentally, but seeing very interesting results, and a wide variety of other conditions. But I think of it as a gravity management tool, actually.
Do you need to see a doctor to get and to use one of these safely? Are there risks involved?
So it's always good to talk to a doctor before you use something like vagus nerve stimulation. It is not a prescription. You can buy vagus nerve stimulators and use them. There are some side effects. Slow heart rate is one of them. If you run very low heart rate or you have arrhythmias, talk to your doctor.
Okay.
But generally speaking, they're quite safe, actually.
Okay. That's number 8. Number 9 is keeping the flow. Now, we just mentioned hydration there briefly, but let's talk about it in more detail. What are the wide-ranging impacts of drinking enough water?
Yeah, so we talked about it in relation to the brain, but there's more than just the brain. As we said earlier, the body is full of pumps and tubes all the way down to the bottom. Even we have these little microscopic microtubules even. And all
within the cells.
Within the cells themselves. The cells are like little organisms, and they're also fighting gravity in their own tiny little way. And so we all work together through pumps and tubes, and fluid lubricates the system. Not only does it help, perfuse the brain through cardiovascular system, but it also helps you process toxins, helps the lymphatic system bring some of the junk in your legs and ankles back up towards your core so that you can get rid of it. If you have a lot of swelling in your ankles, that could be a sign that the lymphatics are not primed well enough. It could be a sign of other things too, like heart failure or kidney problems, by the way. So see your doctor if that's happening. But the other part of this is the immune system. And it turns out astronauts can get infections in outer space, which is unexpected when you're dealing with a completely clean, space station.
Where does the bacteria come from?
Yeah, there's no bacteria really up there. What's happening is the fluid in the body is being redistributed in a way that is causing the immune system to become underactive, which can lead to infections that are already in the body, like certain viruses coming out. Now, we'll, again, have to talk a lot about that someday, But what I'm getting at is your relationship to fluid is going to affect your brain perfusion and your brain function, your lymphatics, and even your immune system. It's really important to stay well hydrated.
All right, that's number 9. The last one is weight loss and diet, or weight and diet. So we're going to talk about a couple of diets that you've come up with that are in your book pool. So for different situations and different impacts.
Well, extra weight on the body is like it's a handicap when we're dealing with gravity. Gravity doesn't change, but our relationship to gravity can change. And as we get older, we need to stay strong to, avoid becoming frail. And when there's a lot of abdominal obesity, especially in this sack of potatoes that we carry around in our belly our entire lives, I call this the GI tract, right? If that gets adipose tissue or fat, it pulls on the back, it pulls on the spine, it affects the microbiome in the gut, which can lead to problems with digestion if those trillions of bacteria get sort of unhappy, which can happen with obesity. And so there's a whole breakdown of body and mind as a result of carrying too much weight on the body. And so, you can, of course, look at your body mass index or BMI, which you can go online. There are calculators, National Institutes of Health, NIH has a very validated calculator. You can put in your height and your weight and see what your BMI is. If you're over 30, you're obese. And the higher the BMI goes, the greater the challenges for managing gravity will become.
And there are also both physical and mental health impacts of food. There's a research centre in Melbourne, in my hometown, called the Food and Mood Centre, where they've done, a decade or more, maybe decades of research into the relationship between diet and well-being outcomes. And the evidence is very strong. The fresher, the more varied, the more nutritious, the better the mood outcomes. So it's both physical and mental.
And this relationship between mind and body also extends to the microbiome itself. We talked about diet a second ago. Again, the trillions of organisms that we co-evolve with have a big part to play in our digestion, yes, but even in our mood. And it turns out in our ability to manage gravity. And that's because serotonin, coming back to that for a quick moment, is produced in the gut primarily, and it requires your microbiome. And it helps you prime the pumps and tubes in your body so you can stand up to gravity. And it turns out there are various diets that can help boost serotonin production in the gut, particularly tryptophan-rich diets. And so in my book Pull, I talk about the so-called Stack 10 diet. It spells out Stack 10, and that spells out 10 different types of foods that are tryptophan-rich. And we'll put that in the show notes for people that want to learn more about the Stack 10 diet.
And it's very subtle effects that are at play here as well. You talk about diets for altitude as well. The microbiome changes depending what elevation you are from sea level.
A whole other interesting, concept is our relationship to gravity also changes vertically as we move up and down, and then eventually up into space, where astronauts, as we've talked about, get a variety of different health issues because we do need gravity to a point. There's like a Goldilocks zone. Too much gravity, too little gravity, not necessarily good. There's a sweet spot in the middle. And it turns out when you go into upper altitudes, it affects the microbiome. It affects the gut permeability, or how leaky your gut is. It affects your serotonin levels. And so in the book Pull, I talk about a diet called the blast-off diet. So this is what you might eat if you're going to go up in high altitudes in an airplane, if you have something called jet belly, or if you're going to be living at high altitude. It's an antioxidant-rich diet that evidence has shown can actually be helpful for astronauts and for high-altitude living. So cover that in the book, and in the show notes, we'll talk about the blast-off diet too.
There you go. That's our top 10 tips for gravity management. There will be more in-depth discussions on all of those topics throughout the podcast, but that's just an overview of the practical tips. But there's going to be lots of theory, like I said, lots of philosophy, lots of neuroscience, lots of evolutionary biology. But in terms of practical tips, and there's more to come as well, we're not going to be limiting to 10 because this is all body health, physical and mental. But just at this point, there are 10 tips that people can take away and practice today in different situations for different benefits and outcomes.
Well, I can't wait to unpack this with you as we continue on. And check out the show notes for more. Check out Pull for more. Can't wait to get into the details with you.
Great. Thanks, Brennan.
If you liked that episode, please like and subscribe and tell your friends about the Gravity Doctors. You can also follow us on social media. Check out the book Pull, and you can also check out our show notes for tips and links to some of our scientific articles. You can follow us online at thegravitydoctors.com. You can follow me, BrennanSpiegelMD.com, and Dr. Lachlan at lachlankent.au.